Hey there! Welcome to the What's Your Thing podcast, where we're all about great conversations with interesting people.
That's right. I'm Brennan.
And I'm Caitlin.
There's something awesome about every person, a thing that makes them truly unique.
We want to know what it is about everyone, so we're asking,
What's your thing?
Episode 9, What's Your Thing podcast. Very excited to have our guest on. We're shifting back to the medical field. Our previous guest, a mutual friend, Kevin Hogan, was a pathologist, and I'm very happy to say today we have one of our favorite people in the world, a respiratory therapist, Mr. Bryson Kitts, joining the podcast. Bryson, thank you so much for being here.
Thank you for having me.
I'm your host, Brennan.
And I'm Caitlin.
Caitlin's off screen. She's running the behind the scenes stuff today, but she'll be enjoying the questions with us. But it's going to be my beautiful bald head with my Movember mustache asking most of the questions today. Bryson, thanks for being here. And yeah, as we said, you are pretty much one of the people who has a unique job in healthcare. You are on the front lines of it, but I'm going to let you explain it. What's your thing?
Well, first of all, thanks for having me. I've been a big fan of your podcast ever since it came out. So
9 weeks ago?
Yeah.
Yes.
Well, I'm a respiratory therapist. It's in the healthcare field. Not many people know who we are or what we do. And to be honest, most people are probably better off not knowing us anyways.
Did you not tell me one time it's like you're the last one to know us and you're better off if you don't, or there's some saying like that? I thought it was really interesting.
Well, a lot of people that run into us are either on a ventilator in a coma in ICU, or usually have a serious lung comorbidity in the community that we would follow. But sometimes we're there in the scenes and you don't realize, because we might be there. We have scrubs. There's doctors, nurses. Like a good example would be labor and delivery. If there's a baby that comes out with meconium or anything in their lungs, we're there to help the team resuscitate and clear the airways so the baby can cry and become nice and pink and sit on mommy's chest.
So that was going to be a question I had before we get into like the background of how you got into this. When people are at the hospital, I find, if like we mentioned Kevin earlier, he's a pathologist, he does research and stuff like that. But when you're on the floor, especially as a patient, as you said, people are all in scrubs. Where do you fit in compared to maybe nurses, doctors who are practicing on the floor? I'm sure you do a little bit of like paperwork, charting, filing, a little bit of everything.
It's a lot like any team sport. We're all on the surface together. We all have our roles. We manage to do it without bumping into each other. And in most cases, working together just makes a better outcome for the patient. So we all do our share of charting, and we all do our share of patient contact, but we do it in different ways. And when we collaborate and do together, we can put the whole picture together for the patient.
So as a respiratory therapist, you're focused on the heart and lungs?
Cardiorespiratory and cardiovascular mostly for us. Anytime you're on high amounts of oxygen, we'll be following you. And like I said earlier, if you're on a ventilator, which you won't always know about, we are with you. But it even goes as far as the community. There are some people who wear oxygen in the community because they have badly damaged lungs or conditions that don't allow their blood oxygen levels to be high enough. So we do home visits too. Anybody who has a CPAP machine has most likely met a respiratory therapist, because we're usually the ones in there selling them, doing house calls, maintaining them. There is a wide range of areas that you might find us, but I guess you just don't know it.
So what led you to finding that? How do you find your way into this career?
Well, it's funny. It's a question that we like to ask a lot of people because, nobody really thought about that program coming out of high school. Like
I don't think I knew what it was until you kind of told me you were taking it.
A lot of people didn't. So it's kind of, when we're teaching students, it's kind of a common question we'll ask, like what made you in the program and whatnot. For me, it's an easy answer. It was my father who suggested it. He's an anesthesiologist by trade. He's retired now, but when I was in university, I was finishing up a degree, and I wasn't really sure what I was going to be doing after that. It wasn't going to lead me straight into a job, but I did know that I liked the sciences, especially healthcare. I mean, I grew up watching my dad, and he was always my hero, right? So, but even listening to conversations he would have, and I always found it so interesting, watching the medical field. I did go to the hospital on grade 9, go to work day, which gave me, an extra boost towards that field. And so for me, I wanted to do something healthcare related. My father suggested it.
So it was a college program after university?
It is, no. So the education requirement for respiratory therapists is you can go into it out of high school.
Mm-hmm.
It's an advanced diploma in college. Some universities will offer it as a degree program, a joint degree program. But for the most part, or in Ottawa anyways, the majority of the people you meet will have done the 3-year program at college.
And then is it kind of like doctors, as part of your program, do you do kind of a residency, or do you just kind of go into that after?
No, we do. Yeah, no, we do. We do 2 years of school in class and in lab, and then we do a full 3rd year of all clinical placement. So that's when we get to see everything, experience everything.
Is that like going to different areas of the hospital? So you get to see if you're maybe ICU, and then you get to see kind of surgery.
Yeah,
it's kind of one of those things.
Yeah, we do. We do every ward or every spot you could be in hospital. We go out in the community. We do pulmonary function testing. We do outpatient work. And we like here, the RTs in Ottawa are lucky enough, they do a rotation through CHEO. They can work with kids, and really it's all age groups.
That's got to be rewarding and terrifying at the same time, I would imagine.
Yeah, well, it's a steep learning curve, but that 3rd year really helps. RTs are I've always been very good at working in teams and supporting each other, and like I said before, you've got the other healthcare professionals there to help out too.
So I guess this is kind of the cool question that I don't want to say it in a morbid kind of way, but as an RT, I wanted to ask you, what are the biggest challenges that you face? And I guess you could go from a day-to-day basis, but I mean, we all just witnessed from 2020 on the biggest pandemic of an entire few generations. What was that like? Is that one probably the biggest challenge of your career as far as so far facing like a virus like that affects the lungs?
I would say it was, just because, up until that point in my career, whenever a patient was sick, the likelihood of you getting sick also was pretty slim. But when COVID came through and it was affecting people in different ways, and especially at the start when we didn't really know how it would affect anyone, everybody, we took extra precautions. We washed our hands a lot. We did our best with the PPE we were provided, which did work, by the way. So it certainly did change the dynamic from going in for a regular work day to going in to work one day and wondering, am I going to get sick today?
Yeah, and I guess it was an ever-evolving thing too. You didn't know how bad the virus was then. Could it get worse? Could it get better? I also thought of it from talking to you a bit during the pandemic. It was kind of like, it's like your job went from being like a healthcare professional taking care of patients who are sick to being a firefighter that's going to fight a fire every single shift. Like it was just chaos.
Right, and
we were told we could just stay at home.
Yeah,
and just be safe.
Well, and that would, for a firefighter, that would probably be a fire that, they don't know what caused it. They don't know if water or say a fire extinguisher is the best thing to put it out, and they don't know what's best for them to wear to protect themselves from it either. So
So
it was different.
okay, so can you take us back to the early days of COVID? Because I think we're all still trying to understand what happened, and walk us through what a day is like on the COVID ward in spring 2020 when we don't know what's going on.
Well, I guess back then, to be honest, when you were working back then, whether it was COVID ward or not, you treated everyone as if they had it, because you didn't know who had it, who didn't. People might show symptoms later. We did know there was asymptomatic transmission. So there were the COVID wards that you knew the patients had it, but we still worked the same. We wore the same PPE. We kept our masks on. We had face shields, gloves, gowns. We did all that to work with really any patient. So which was a huge 180 from before that, where we wore mainly minimal stuff. I would see lots of patients before COVID, maybe just on the ward, someone who's not sick. I may not wear a mask, but at the time we didn't have masks, weren't a regular thing to wear unless you felt there was a need to do it. But
so did you see a lot of positives? I can only imagine that a lot of research came out of this that just showed like the shift of like health and safety, cleanliness in a hospital ward. You probably learned a lot from those experiences. Did the culture shift?
absolutely.
Certain standards have now been
Yeah. Like a lot has changed with infection control. Just look at the mRNA vaccines, right? How quickly that those came to fruition. To roll something out like that I would think would generally take a very long time. We had those pretty quick and into arms pretty quick.
It was like a pretty cool thing to watch how the whole entire global community kind of came together around this one thing. And then you saw like.
But I mean, it wasn't just us. Everybody learned. People were washing their hands. People were wearing masks in grocery stores. People were wiping down cart handles. Like, we learned a lot where we were, but I think the learning curve was more a global thing than anything.
Did you find in the chaos when you were working and it was absolutely nuts and you didn't know day to day, like you have a family, I'm going to work, am I going to get sick, am I going to get my family sick? One thing I thought was pretty cool at the beginning was how the community kind of came together in support of people like yourself or people who were on the front lines, and people were donating masks, making masks. Did that help you through the day to day?
Oh yeah, absolutely. Like, at the start we were worried about that PPE shortage. So the masks, everything, even like the hats that got made for us and stuff, because we'd cover our hair too. We weren't sure if droplet particles getting on our hair would transfer to our hands, things like that. But definitely the community rallied around everybody. It was really an amazing thing to see. And I think all the healthcare professionals were greatly appreciative of that.
Oh, it's like, I don't think it's pretty fair to say we were all pretty grateful to healthcare professionals too, because we didn't know anyone, I guess, at that time at the beginning. I remember it was pretty scary. You're thinking like, am I going to get this? Is it kind of like, you're hearing all these stories about like nobody knew what was going on. And then you saw those movies like Outbreak back in the day. And you're like, is this literally like, you see shows like The Walking Dead. I know it kind of sounds silly, but it's like, could this be absolute, like, what if it was like the bubonic plague or something like that? That is absolutely terrifying.
Well, I think something interesting to know is that your wife is also a respiratory therapist.
Yes.
And your children were very young.
Yeah.
And so we're all locked at home, not knowing what's going on, and you and your wife are in hospitals, and you're going to be interacting with COVID patients. So how did you do that with your young babies at home?
We honestly, we just did our best when COVID first hit. I had one child under 2, and my wife was actually pregnant with the other one. So both of my family members fell in the high risk category. really, to be honest, the way we dealt with it was just to be as vigilant as we could with PPE, to do our best, and really just hope for the best too.
Yeah, I did definitely feel bad because I think one thing I'd like to highlight that I appreciated about everything that you and your wife went through was we all got to hide in the quiet, waiting for the peaks to go down, and then we'd all reemerge for a bit before the next lockdown and see each other. But it was almost like you guys had to be like, okay, I have to go to work, and then I don't want to risk my family. And it's like I feel like you're at work or you're at home protecting yourselves. Is that fair?
Yeah, I mean, the weird thing for me during COVID was like my day to day never changed. I still went to work. I know a lot of people work from home, or unfortunately for a lot of people who got laid off and things like that. But my job and schedule never really changed. I still went into work every day, and so the reality. So I'm not even sure that much of the reality for anybody who didn't go to work. So like all the working from home and that kind of stuff. I just go by what people said, but I could imagine that was a much larger change, I would think, for any of those guys than it was for me.
I admire like the mental health struggle was significant for a lot of people, and I just appreciate that people in healthcare. It's one thing to be working from home, you kind of get down on yourself because you're like, oh, my life's kind of been taken up in arms, but you're not out there every day at risk of exposure and stuff like that. So that's one of the things I think should be highlighted to anybody who might be watching this, and what the healthcare professionals and frontline workers went through was putting themselves out there to be at risk, while the rest of us got to try and avoid this as much as we could. But we talked a bit about how the culture of the hospital has changed. We talked a bit about how you said your hand washing, wiping down carts, people wearing masks. How has your perspective changed now, having gone through that since when you started this position and when you went into it?
Well, I think COVID was one thing, but just working in healthcare has changed my perspective on. I think I'll probably take my health a little more seriously, and I try to encourage others to do the same. Even just the little things, diet, a little bit of exercise, just trying to take care of yourself. Even sleep is a big one. Like a little bit can go a long way when it comes to making healthy decisions, and I think that. Seeing what could be the end result of not doing so, I guess maybe changes my perspective on how I'm gonna sort of lead my life.
So that's a good model. A little bit goes a long way. I think I can start with that. I need to exercise a little bit more. So with respiratory therapy, I mean, we are in the time of unbelievable. I feel like we live in a time where there's so much technological advancements and breakthroughs that we don't even acknowledge it. So even in your time, what's changed a bit about respiratory therapy, and what do you see for the future? Where's this going?
Well, even in my time, we've had some fairly big changes. The biggest ones would be with the ventilators. Not only technology wise. When I first started, we still had ventilators that we were opening up, taking the pieces apart, and putting them back cleaning them, putting them back together. Now, a ventilator costs as much as a car, or a high-end car. They've got good computers in them. They can deliver a breath to a patient, as close to a natural breath as possible. But even using that technology, the research that's come behind it is unbelievable. There's a lot of things that we would do when I started that we don't do now. There's novel approaches that we've tried and work very well. Again, COVID was a huge catalyst for that, because it was a big respiratory disease and affected a lot of people's lungs. So it became difficult to ventilate people. A lot of research went into the best way to ventilate an injured lung. So that stuff we've now carried over into the post-pandemic era.
So it's just going to be evolving research.
Yeah,
it's just get this better and better and better.
Yeah, like the technology is coming along so fast, and you combine that with the research that's coming out, and there's some pretty amazing things coming down the pipe.
So you think like maybe even for diagnoses and stuff like that and treatment, it's just gonna be that much more effective as you evolve, just because things are getting better, technology's getting better. That's
Yeah.
awesome.
And I mean,
that's good to know.
and it's not just in the respiratory field, like it's all of them. You know, all of medicine is really coming up. You know, like even things like, you know, my mom got her knee replaced a couple months ago. You're in and out in the same day now for that, right?
Insane.
You know, that used to take at least a couple of days of rehab and you know, sitting on the ward and getting better and then going home. But it's just even like I you know, I listened to Dr. Hogan's podcast. The advancements in pathology are like that, all of that stuff too, right?
Like you were saying, AI learning is going to just take things to the next
right.
step. So what would surprise people most about respiratory therapy? I guess, because like you said, I feel like it's something that's taken for granted. You kind of see the nurses, you know, when you see a doctor, but you guys are right there. You literally control the heart and lungs, two of the three most important pieces of your body, really.
I think probably I touched on it earlier, but I think probably the biggest thing that would surprise people is just, you know, how much we are there that you don't realize. We are always, you know, I guess we never advertise our presence. We and in most cases we're sort of we come when we're called type thing. So a lot of times we're in and out because our patient assignments or the things we need to do, we usually do things quickly and move on to the next person. But I think to answer your question, it would just be that, you know, we're there, you know, and people don't really realize it.
I guess, like I said, it's taken for granted. You are literally there at the most important points, and people kind of, they either don't want to meet you or they don't get to meet you because you're saving their life and then they're recovering. So you obviously have a very important job. The people in your profession have been through a lot, just like anyone in healthcare and emergency services, frontline services in the last couple of years. Is there any takeaways from this kind of podcast that you'd like people to know that a respiratory therapist could kind of, some information that you could share, something you could tell people that you just want them to know about your trade?
You know what? Not really. Like you know, we're there whenever anybody needs. You know, a lot of people will run into us at some point, some more than others. But really, just for my trade, like, you know, we're there to help. And I guess you know, just if to do your best and be as try and work on being as healthy as you can, so you don't end up with any issues later in life.
My takeaway, I think, is diet, exercise, sleep.
Yeah.
Just a little bit
They
at a
go
time.
a long way.
Start a little bit at a time.
That's right.
I'll go for like a 10-minute walk to the fridge after this podcast. Grab a beer.
Grab a beer.
Just take 10 minutes on my way. So thanks a lot for doing that with us. Like, now we kind of end with a little bit of fun. If you got anything you want to share, we know about your thing. Tell us something that's not about your thing, that's about you.
Well, I mean, to be honest, right now, my kids, my wife, they're my life. I have two small kids, two little girls. They're 5 and 3, so they're very busy. And now they're getting even busier because they're getting old enough to start skating and swimming and sports and stuff. You know, I'm an RT who works shift work, so I do work a lot of weekends. So my spare time is I spend as much as I can with them, but I do, you know, like to keep an interest in my hobbies, like, you know, hockey. I like to be outside, fishing, hunting,
yeah.
going up to the cottage, and, you know, all summer long is something we love to do. And
yeah, it's a lot of fun.
yeah,
And I think it's important to say, because we mentioned her twice now, but your wife's name is Carrie.
yes,
And she's a respiratory therapist too, and she worked all during COVID. So
yeah,
And
thank
then,
you, Carrie.
yeah, well, that's just, I guess the way I would close this is, yeah, thank you, Carrie, but also to, it's kind of neat to have people like yourself on here. It gives a human side to what everybody saw in that chaos, and for yourself, the other respiratory therapists, especially working with the pandemic, and then everybody else who was on the front line. You know, this is an opportunity for us to say thank you, and, you know, anybody who's watching, I'm sure they want to express it as well. But that being said, thank you for everything you did. But also, thank you for being on here.
Hey, thank you for having me. It was a pleasure.
Yeah, we had a blast. That was really good. And Bryson Kitts, is there anything you want to plug for the Ottawa Hospital or anything like that? Charities or anything like that? I know the Heart Institute is really important here in Ottawa.
Every hospital has a foundation that you can donate to. So, depending on what part of town you live in, or depending on everybody has a history with one of the hospitals around. They've all got foundations. They're all a little bit of money always goes a long way for them. So
I think Ottawa's pretty cool. You can kind of do your research and donate to something that means something to you, right?
Yeah.
Research.
Yeah.
So that's it. Check it out. Ottawa Hospital. And Bryson, episode number 9, What's Your Thing podcast. Thank you so much for being here.
thank you.
So make sure to check us out. whatsyourthingpod.com. Check us out on Instagram, YouTube. Follow us on TikTok. Check us out. We're going to have a blast. What's your thing?
What's your pain?